Hello, everyone. Welcome. And before we dive into today's case review, I am very excited to announce my first in-person course of treatment planning based on biomechanics using Onyxceph software. This will be happening the 3rd of May in Barcelona, and this course is designed for those who require to refine their clear aligner treatment strategies using biomechanical approach, ensuring predictable and efficient results. So stay tuned for more details and let's get started with the case review today. This case review is this beautiful open bite, which I'm going to show you the best way to develop. Now, these cases are very complex because they usually require additional anchorage, such as mini screw, for example, for the intrusion of posterior teeth, because we are not able to intrude too much posterior teeth without skeletal anchorage. So today we're going to check step by step all of the step of the design, and I'm going to show you why I develop it this way. Now, you see that we have some sort of triangular shape of the arch. So I always start my treatment plannings by expansion of the arch, developing of the arch. So initially, we're going to have some expansion of posterior teeth and some distalization of 7. Slightly, you can see, but mostly it's a rotation of 7, and this will give you some relative distalization, we could say, and some slight distalization. But more than expanding, you can see the indentation of the palatal cusp here. So what we need to achieve is torque, more root torque, because we have impactation of the palatal cusp and we have those contacts there that we want to remove. So initially we're going to do some expansion, but with a lot of root torque in order to upright that tooth. And then after we have done you can see we start initially with the expansion. Let me place this a little bit, not that fast. So you can see we're giving the torque, we're giving some expansion, we are derotating. Once we derotate, we do the slight distalization that I have programmed, and then the intrusion of posterior teeth with extrusion of the upper anterior teeth. Now, this should be the protocol. Always try to initially, if you need to derotate anterior teeth before the extrusion, make this derotation and then extrude the anterior teeth. It's always better to have the extrusion at the end when the teeth are already aligned. Always start with your arch expansion and then make the extrusion of anterior teeth. So you're going to see in this view, I am developing the arch, then some distalization, slight distalization. I think in this area, there's not much distalization, and then intrusion with extrusion of anterior teeth. Now you can see that I'm placing the mini screw. This is something that usually the doctor should tell you where and at what stage to place the mini screw. I place it when the intrusion of posterior teeth starts on both sides, and also with the help of class 2 elastic, you're going to see um, this bite jump at the end of the simulation. Now, you're going to ask why I didn't place mini screw. Now, this is usually something that the doctor should tell you. Um, in this scenario, we did not place screws in the lower because we don't have much intrusion. We have about 0.7 millimeters of intrusion in that 7. So I'm only doing it with sequential intrusion. Now, this is something very important, to do a sequential intrusion of posterior teeth. You can see how 7 is intruded initially. After it's rotated, intrusion start, and then we start with 6, and then with premolars, and at the same time we are extruding lower anterior teeth. Now, this is very important to make this staging, because if you start intruding all posterior teeth at the same time, you're not going to have enough anchorage on anterior teeth. So we need to make some sort of sequential, similar to the sequential distalization. You intrude 7, then 50%, you intrude 6, and then 4 and 5. Now, this will depend how many teeth you need to intrude. Here, most of the posterior teeth need some intrusion. Seems like here, this needs to be staged until stage 14, that we place the elastic and the mini screws to help with the mandible movements. And then at the end, we have this bite jump. Now, all of this can be done in the software. And It's actually not that hard to make the pie jump. It's very easy to make it. You can learn this in my training, in which I'm going to show you step by step, because it's very important to know which tooth you're going to move first, how you're going to start your alignment. And it's not easy to make designs. Um, so everything it's in the software. And for example, if you want to check, let me show you here the movement table and the staging as well, how the staging should look in this case. Let me show you over here. Hold on 1 second. So the staging should look something like this. Now, let me show you the values here. You're going to see initially in the posterior teeth, the torque that I was saying, the rotation and angulation, everything. And then you're going to see the intrusion here of posterior teeth, the mesialization here, and you can see the staging of the mesialization that usually 50% 6, then 4, 5, and then 4. The same for the other side, and the sequential intrusion as well of the posterior teeth. Now, this is very important to make this staging for these cases. Um, as I said before, the other important thing is the diagnose. If you really need the intrusion of posterior teeth, this is very complex to achieve only with aligners. So I will advise you to use mini screws most of the time, develop the arch initially, and leave the extrusion at the end. All of the vertical issues, I leave it at the end so you can have more control of the movement. Because if you combine rotation and extrusion, you're going to have different movements in space at the same time, and the aligner is not able to make this movement correctly. So always it's better to do more